Good afternoon. Thank you for joining us today. I'll be your host for this webinar. My name is Françoise Vamek, and I'm in charge of a program aimed at improving cancer patient experience. Because besides medical or technology progresses, humanizing care is also very crucial in the fight against cancer. Now, let's take a look at the agenda and what you could expect to learn today. This is the second webinar focused on cancer patient support and specifically dedicated on how to develop and how to operate a cancer care center. So what exactly is a cancer care center? It is a facility located near hospitals that addresses most of the patient needs. They offer complementary services such as education or emotional support. In this session today, our intent is to delve into the activities provided by these centers and to highlight the positive impact they have on people. We are very pleased to welcome Régine Simonis from l'Espace Vivi, a Belgian cancer center, and Andy Anderson from Maggie's Center Network in the UK. Régine and Andy are going to present a day in the life of a center and the impact of that support on people and their families. Before we begin, here are some practical details. The webinar will last for 45 minutes. This webinar is being recorded and a replay with subtitles will be available. If you have any questions or comments, please use the Q&A button and don't use the chat button. Régine and Andy will address all your questions during the Q&A session at the end of the presentation. Our first speaker is Régine Simonis, coordinator from l'Espace Vivi in Belgium. Régine will present the program and activities proposed in several Belgian cancer centers. So thank you, Régine, for being here with us today, and I hand over the floor to you.
Hello, I'm Régine, coordinator of Espace Vivi, a support care center based in Verviers. Today, I will give you some information on the support care centers in Wallonia, en maisons de ressourcement, as we call them in French. So, what do we do in support care centers? The particularity of integrative medicine is that, in addition to the sole medical care, our centers also offer complementary care to the patient. Our therapists take care not only of the patient's body, but also of the mind. We support and assist the patient throughout and after their medical treatments. The first centers opened their doors 10 years ago. Usually the creation of those centers is an initiative of a group of people, typically doctors, care patients, nurses. More and more medical teams are convinced of the benefits of those centers for their patients. Unfortunately, finding the financing of these centers is still difficult. At present, we have about 30 centers in Belgium. So let's put those centers on a map. You see that I listed 12 centers in Wallonia, which, while all different and independent from one another, have signed an agreement to be part of a network. One of the goals of that network is to protect the cancer patients by making sure that the centers respect certain rules, such as the requirement to have a strong connection with at least one hospital, the requirement to have an oncologist sitting on the board, offering free access to patients or at minimal cost. Of course, we are always happy to welcome new centers as long as they adhere to our values. Who worked in those centers? Of course, you always have a board of directors or management committee who has strong relationships and collaborates with the local oncology center. Then you have the coordinator, the therapists, and the team who welcomes the patients. Depending on the centers, therapists are self-employed or employed by the hospital. They also may be volunteers. What do we do in our centers? We propose two kinds of activities, either individual activities or group activities. The most common individual activities you will typically find in the support centers are massage, body, head or hand, foot or hand reflexology, aesthetic treatments. These can vary as each center has a personalized offer. At Espace Vivi, all the activities we propose are selected by a scientific commission, which is made up of 3 oncologists, 1 psychologist, 2 members of the board of directors, and myself. In the group workshops, some of the activities offer a direct psychological support, whereas others are rather an opportunity to meet other patients, share experiences, and overcome the isolation. What are the benefits of that support? The cares help improve the quality of life of the patient by reducing the stress and relieving them from the undesirable effects of the conventional treatment. It helps to restore their confidence. It facilitates relationships with their families, friends. It also restores their self-esteem. It gives them a sense of identity and physical integrity. It breaks the isolation, promotes relaxation, and increases the acceptance of the treatment. Who can come in our centers? In our centers, we welcome all the cancer patients, regardless of the type of cancer they have, and we also welcome their families for certain activities. Our centers are open to men, women, and sometimes children, depending on the center. The patients are welcome as soon as they're diagnosed and can visit our centers up to 1 year or more following their treatment. And finally, you have here a few words from our patients. Working in those centers is really rewarding, emotionally challenging. We meet some wonderful people who I find very courageous and resilient. Thank you for listening.
Thank you very much, Régine. We now have a better understanding of the amazing support you provide. Our second guest, Andy Anderson from Maggie's, is going to explain Maggie's model and its impact on patients and their family. The model of support is slightly different, but the goal remains the same, a compassionate assistance to patients. Thank you, Andy, for being here with us today. The stage is yours.
Hi, thank you so much once again to IBA for this opportunity to be able to give you a deeper insight into the support that Maggie's Cancer Support Organisation provides. My name is Andy Anderson. I've worked with Maggie's for 23 years now, and I used to be the centre head of Maggie's Edinburgh, which is the first of the centres in the UK. I now have a role supporting centres across the UK and internationally. And I'm keen within this session to be able to give you a deeper understanding of what the programme of support that we offer at Maggie's is, how people access it, the nature of how we provide it, and the way in which people give us feedback about that. I'm going to talk for around about 20 minutes, and then there'll be opportunity for questions at the end. So importantly, this is Maggie. So this is the person who the centre is named after, or the centres are named after, a really important woman, somebody who within her mid-late 40s was diagnosed with an advanced breast cancer diagnosis. She was married with 2 children, and her world turned upside down as a result of her diagnosis. She was at the top of her career, she was travelling, she was having a wonderful life, and things changed dramatically for her. Within that experience, she wanted to do the best she possibly could for herself within her cancer diagnosis. She felt very supported by her medical team and by her nursing team, but she also wanted to make sure that not only she, but her husband and her children and her family were supported. And she recognised that there were some gaps in the National Health Service and that they weren't able to fully provide the support that she and her family were looking for. So within her experience, she chose to look at what other support resources might be available and to consider whether or not something could be done differently within the UK. And now Maggie's as an organisation exists as a result of her pioneering, inspiring work, and also her desire for not only her and her family, but also the other people she met who were dealing with a cancer diagnosis to be better supported. So Maggie's centres are really importantly based on some basic fundamental needs that Maggie described. She wanted to be able to understand her experience and her cancer treatment in a way that was different than her experience in the hospital. She wanted to be in an environment where she felt uplifted, where she felt close to nature, where she was able to relax and talk away from that busyness of the hospital space in a place that felt much more like home. She wanted she had the need for a welcoming, reassuring space, but also somewhere that she felt confident in who she was speaking to and what sort of conversation she would be able to have, finding out information, but also meeting other people in a similar circumstance. And we've taken her blueprint and 27 years later have a network of centres across the UK and internationally. Credit to Maggie and credit to her family, who are very much still involved in the organisation, giving guidance to the way in which we continue to grow and develop the support we provide. So importantly, what Maggie's does is unique. There are no time limits to visits. People can come for as short a time as they wish or for as long as they wish. Often people come to ask a very detailed question and have their needs resolved. For other people, they come to speak at length about the complexity of their circumstances and explore more of the existential crisis that they're in. The support is very much tailored to the individual's needs. Although there is a program of support, it's important that the individual has the choice to embark on different parts of the program, whether that's individual support, group support, courses, workshops, and importantly, the healthcare professionals working in the teams will guide people through that program and tailor the support to the person's needs. Those professionals that work with the teams are highly experienced professionals. So my background was an oncology nurse of 13 years prior to working at Maggie's. We aim to be able to recruit people who have significant oncology or psychological experience prior to coming to Maggie's. It's such an importantly profound way of working that we want people with good experience and very solid experience prior to coming to Maggie's. And then obviously those individuals have training when they come to Maggie's as well. The support that we provide is very close geographically to the hospital. We want to make sure that people don't have to get in their car and find another parking space to come to Maggie's. They don't have to get on the bus and take another journey to Maggie's. It's immediately adjacent to the oncology clinic or to the oncology chemotherapy suite. The spaces are warm, welcoming and uplifting environments, and all of the support we provide is free. There's no referral required, but we work very closely with our NHS and hospital colleagues and other cancer support charities to make sure that people feel able to be signposted to the centre, so that it makes it more straightforward for them to be able to come through the door of Maggie's. And now, importantly, we are a network of national and also international centres. We started as one centre in Edinburgh with no expectation of more than the Edinburgh Centre. Then there was an opportunity for us to be able to grow across Scotland and then across England and Wales. And we have 3 centres internationally, one in Hong Kong, one in Tokyo and one in Barcelona. We've just gone on site in Groningen in the Netherlands, and next year going on site in Stavanger in Norway. So our programme of support is very important. It's importantly simple, but also importantly very complex. Everybody who comes to the centre is able to access their support, whether that's a person with a diagnosis, whether it's a family member, whether it's friends, whether it's colleagues, or importantly, whether it's healthcare providers. People can come at any stage, so many people come to the centre at point of diagnosis and going through treatment with an expectation of full recovery, but there's a number of people for whom they continue to use the centre knowing that they won't be able to recover from their diagnosis, and they tend to be the population who use the centre for the longest, particularly because of innovations in cancer treatment, helping people to live longer with advanced disease and metastatic disease. And importantly for family members, we'll support them through any of those stages, and very importantly, we provide a bereavement support service if anybody experiences a sense of loss. You can drop into the centre, so you can walk out of your oncology clinic and straight into Maggie's, or you can phone us to make an appointment to come and see somebody. It's entirely up to the individual. Some people prefer that flexibility, and other people like the structure and the commitment to that ongoing support. Everybody's got access to the core programme, and that core programme is facilitated by cancer nurses, by clinical psychologists, by benefits advisors, and importantly by health advisors wrapped around nutrition, wrapped around exercise or stress management. And as I've said, we have 24 centres across the UK and 3 centres internationally. Our professional teams are something I have a huge regard for. We have an exceptional group of professionals working in each of our centres who are fully committed to providing high standards of cancer support based on what the individual's needs might be. Our centre heads are either clinical psychologists or cancer nurses by background, all with an extensive experience of cancer care and cancer service delivery. Our clinical psychologists come from a range of backgrounds, but all have focus on providing support around existential crisis, support around health behaviour change, and living with uncertainty. That support from clinical psychologists can be on a one-to-one basis, as a couple, or as a family. Our benefits advisors, particularly in the UK, are focused around financial support, helping people to be able to access the support that government might offer, or voluntary sector organisations providing grants, particularly at this time where we've seen a definite increase in the cost of living and people's need for financial support greater than ever before, with it being one of their top-ranking fears and questions in and around their diagnosis. Our exercise specialists have a range of skills, some focused around prehabilitation, getting ready for treatment, and some around rehabilitation, but generally focused around simple activities that are accessible and easy to manage, particularly because of fatigue associated with the cancer diagnosis. So we use restorative yoga, simple Tai Chi, Qigong process, Nordic walking, gentle exercise as part of our courses and workshops. We have a range of professionals who give advice on healthy eating, all of which is focused around helping people to maximise their health benefit and deal with some of the challenges that a cancer diagnosis might encounter. So appetite loss, loss of taste, change in weights, either weight gain or weight loss, altered bowel as a result of a surgery, giving guidance around how to maximise health and well-being around those changes. And often those sessions focus around supporting family members to think of how they can best support their husband, wife, or family member in relation to food. And very importantly, information. One of the key roles of our cancer support specialists is to be able to translate the complexity of medical language that is often very complex, cutting-edge language around innovative approaches in clinical trials, but also just the complexity of understanding language that relates to a very scary subject. Many people who come into Maggie's are very intelligent, very able to make sense of information, but in the midst of their diagnosis often describe feeling quite overwhelmed and unable to really make sense of. So we provide a translation service and also trying to make sure that that fits in the person's paradigm of what their understanding is. And one of the crucial things of Maggie's is creating a facility for peer-to-peer support. So we run groups, courses, workshops, and a range of support resources, often around a kitchen table, but also within closed-door support group rooms, helping people to meet one another in the midst of their diagnosis. The wisdom of group is often far greater than the wisdom of an individual experience with myself or one of my clinical psychology colleagues, because the lived experience and the honesty and the frankness of conversation that comes from group can often be transformative. And the vast majority of people who come to Maggie's are psychologically well, but traumatized by their diagnosis. So they still have a concrete sense of identity, a concrete sense of self, but are struggling with the enormity of what their diagnosis might mean to them. And often the restorative support that a fellow person dealing with a similar diagnosis or somebody who has dealt with a similar diagnosis can give can often be more accelerative in their recovery or their adjustment than purely a one-to-one session with a healthcare professional. But all of those group sessions and courses are facilitated by one of us as professionals within the centre to make sure they continue to be safe spaces to be able to get therapeutic support. Our environment is a fundamentally important part of Maggie's, and the environment lends itself to helping us talk about this range of complex issues, living with the impact of a diagnosis, whether it's the impact of a diagnosis that has curative intent or not, living with the consequences of the effects of cancer treatment. So often for people dealing with side effects of chemotherapy that are enduring, the complexity of pelvic radiotherapy, the complexity of surgery, and how that has an ongoing impact while the person is expecting to try and return to work or try and return to normality, but they're still wrestling with ongoing issues. And Maggie's is very much an ongoing resource to help them adjust to those changes. It's a place to look at the emotional expression for the consequences of a cancer diagnosis. So a change in identity, a change of self, a change of self-image, body image, intimacy, those types of changes. And giving space for the things to be spoken that often are very difficult to speak about in busy, complex clinical environments. Maggie's has the space, both physically and professionally, to be able to take time to look at those more sensitive, more complex issues around sexuality, fertility, loss of identity, loss of certainty, loss of confidence. A lot of the work we do is around families and supporting the children of an adult with a cancer diagnosis to understand what's happening to mum or dad or to a grandparent or to a sibling, and then helping families to function healthily and effectively, and also helping relationships to sustain a cancer treatment experience, but also to recover from the complexity of cancer. There are many changes that come, often wrapped around fear, often wrapped around an unknowing about whether it's appropriate to have intimacy within the relationship, and the complexity of cancer can get in the way of often how people most effectively communicate with one another about sensitive issues. And often it's the case that we'll provide support after a cancer diagnosis to help people's relationships to be cared for and to be sustained after a complex experience of cancer treatment. And importantly, returning to work. We spend a lot of time not only with the individuals, helping them think about how they bring a language to their employer, but also how they bring a language for themselves in terms of their planned recuperation, what it might be that is a reasonable expectation for self rather than an unreasonable expectation. And also some of that work is directly with employers, helping them to understand what the needs of their employees might be in either returning to work after a cancer diagnosis or living with a cancer diagnosis while working. We run a Cancer in the Workplace series, which is a really important session in helping employers to support their colleagues as effectively as possible. And importantly, living with and beyond a cancer diagnosis. Many people who come to the centre, in fact, last year across our organisation, over 60% of the people who came to the centre were coming to the centre with a curative intent. But importantly, for a lot of people who continue to come to the centre, they know that they're living with a cancer diagnosis. And as I mentioned earlier on, a lot of people, thankfully, are being much more effectively treated for their cancer diagnosis, which means their longevity is much greater. But part of the challenge of that longevity is dealing with often chronic, constant treatment, chronic immunotherapy, chronic chemotherapy, which comes with significant challenge, and also the significant challenge of moving from scan to scan, moving from clinic to clinic, and being unsure about the sense of future. So giving people a space to look at that fear, giving people a space also to look at how they confidently restore a sense of identity within this new space, but also an ability to be able to look forward, an ability to look forward to tangible things, but also existential things. This is a very busy slide and it might be difficult for you to be able to fully see it, but this maps out where Maggie's fits alongside people's cancer experience. So in blue, we have the NHS cancer patients pathway from diagnosis, primary treatment, through remission and recovery, or for people for whom they have advanced disease or a recurrence of their disease. And in the orange line, these are the series of elements of the programme designed to fit around people's needs at those points. So at the very start, we have prehabilitation, which is a newer part of the programme that we developed over the last 3 years, looking at preparing people for treatment at a psychological level, but also a physical level. So exercise preparation and nutrition preparation. And we run prehabilitation sessions in our centres. We also run a Getting Started programme, which is very much aligned with the NHS, giving good solid information about what to expect from treatment and what to do in case of. So the emergency phone line in case you have side effects, the likely side effects of treatment, and what to do in case of. So we run those sessions alongside the NHS in Maggie's, helping people to prepare for their chemotherapy, immunotherapy or radiotherapy or surgery experience. Within the whole element of support, there are ways of being able to come and just talk about the experience. So whether that experience is still moving through a treatment experience or dealing with the end of treatment. But in this next section, we have where now and rehabilitation, which tend to be focused on people who have come to the end of a treatment regime, either curative treatment and looking to fully restore and recover back to health, or importantly, people who have come to the end of a period of treatment who may require treatment at some point in the future, but very much with that health behaviour change sense of model, looking at what they can do for themselves, but also helping people to be able to find a way of talking about the sense of vulnerability, talking about the impact of their diagnosis and how they recover from some of the traumatic elements of that without feeling like they just need to fast forward out the other end of cancer treatment. We have a programme called Ongoing with Cancer, which is about looking at supporting people who have a constant and chronic diagnosis that they know will be unremitting and helping them live well with that, but also confront issues around the fear of death and dying, preparation for death and dying, and being explicit about wishes and needs, whilst also wishing to continue to have a good life ahead of them. And importantly, as I mentioned before, a bereavement support service for family members who have had any experience of loss. And importantly, family members can make use of all of the other elements of the programme. So if they're alongside somebody supporting them, they would be able to have their own support alongside that treatment plan also. Rehabilitation, as I summarised earlier on, is either getting started with chemotherapy, radiotherapy, often decision-making about prostate cancer treatment, preparing for head and neck treatment, and then eating well during treatment, plus also staying active during treatment. This has become a really popular part of the programme of support, people wanting to be able to be as ready as possible. And it's also very strongly signposted by the NHS because they want people to be in as well a position as possible for their treatment. Rehabilitation at Maggie's tends to focus around our courses called Where Now, but also we run a series of workshops looking at supporting some, for example, in the Edinburgh Centre, we have a head and neck wellbeing clinic for people 6 weeks at the end of their treatment for head and neck cancer diagnosis, where we collaborate with dietitian, speech therapist and dentist to be able to look at some of the functional elements of recovery, but also the psychological elements of recovery. Another course we run is Living Well with Prostate Cancer, helping people to look at some of the complex elements of sexual function, exercise, identity, confidence, continence and relationships as well as work. And then rehabilitation focused around exercise. And I've included cancer in the workplace because often that is a really important part of how people return to work and return to restore their sense of ability and well-being, helped by their employer. From our point of view, Maggie's is working. Last year's audit showed us that 99% of people found their visit to Maggie's enabled them to understand more about their cancer diagnosis and treatment. 99% reported an improved ability to manage their stress. 98% improved their confidence in talking to family and friends about their cancer diagnosis. 97% improved their confidence when speaking to their medical team, able to ask more challenging questions and able to find out more important information for them, tailor making that information. 92% made healthy changes to their physical activity, and 89% made healthy changes to their diet and felt more in control of their dietary process. As I've said before, and I'll quickly move over this because I'm at my 20 minutes, just how important it is for us to work complementing the NHS. The NHS is an extraordinary resource in the UK, and we want to work aligned with our cancer centres and our cancer hospitals. Our keenness as an organisation is to make sure that there is a Maggie's at every cancer centre across the UK. We have 24 centres at the moment. There are 60 NHS cancer sites across the UK, and our keenness is to make sure that everybody has access to the services I've just described. The first image there is Edinburgh in 1996, which is when we very first opened, and those are our 3 international centres. And this is an image of the inside of our Glasgow centre, a beautiful, restorative, peaceful space.
Maggie's teams of highly trained staff provide support for people living with cancer throughout the UK. What sets them apart is both their approach and the environments in which they work.
We've never actually been able to produce a kind of little thing which says what is a Maggie's, which is an obvious thing you'd think we ought to have. But it's almost impossible to write it down.
It's a hybrid building by nature, and it's a church that's not religious. It's got art in it, but it's not a museum. And it's a house which is not a home.
What is a Maggie's almost is the experience of being in a Maggie's.
And again, relax your shoulders.
Each Maggie's Centre runs a support programme which includes everything from nutrition classes and wig fitting.
I think when I start to wear it, I'll just get used to it being there.
Yeah.
To bereavement counselling and Tai Chi.
People at the Maggie Centre say, I've got cancer. And you can talk quite openly about it. In the past, you were diagnosed with cancer and that was the end of you. Now, lots of people survive for long periods of time. And coming and seeing people that have survived, that's the biggest boon ever, isn't it? There's still life to be had. You know, it's not all over.
Thank you so much, Régine and Andy, for sharing your experiences. Your work is really inspiring and very important for the patient. So we thank all participants for your attention, and we now invite you to ask any question you may have. Please use the Q&A button and not the chat button. So we have already received a lot of questions. So if we are not able to cover all the questions, we will make the follow-up afterwards. So let's start with the first questions. It's related to the programs and the activities. So maybe I will start with Andy. Andy, how many patients do you welcome on average per day in your centers?
It partly depends on the size of each of the centres. The Maggie centres across the UK are of different sizes adjacent to different size cancer centres. But for the large hospitals like Edinburgh Cancer Centre or the West London Cancer Centre, within the Maggie centres, we would be expecting to see around about 120 to 140 people a day. So they're busy centres. They're very active with lots of different parts of the programme that I've described, but also we're trying to make sure that each of the centres, in the way that they're designed, have the capacity to house that without it feeling overwhelming and without it feeling busy. The use of the outside space as well as beautiful inside spaces give the capacity for many people to come throughout the course of a day, and for it not to feel overwhelming, but it to feel energetic and lively and full of people. One of the things that a lot of people describe in coming to the centres is that they don't expect to hear so much laughter. They're coming to talk about a very serious subject, but the centres are very animated spaces with a lot of energy within them, which is about really trying to give people a sense of control back again. So I'm delighted to say that our centres are busy spaces.
And what is the average duration of a patient stay to your centers? How many activities are they participating in?
That really varies based on the individual's need. There are a number of people who will come to the centre and their need is very factual. So it might be that their primary need is a financial need. So they come and meet with the benefits advisor to complete the complexity of those forms, to be able to make sure they're financially stable. And that might only be 2 visits. But for the majority of people, we would expect them to have at least a series of 8 to 10 visits to the centre. For some people, they come every day for the duration of their radiotherapy. So they're with us for 6 weeks, having treatment for a brain tumour diagnosis every day. And for other people, we might see them over the course of a number of years if they're having ongoing constant therapy. So I guess the appropriate answer is an open door. It's up to the individual how much they want to benefit from the centre. Our keenness is to make sure that we're always enabling change and supporting change, and that people don't become dependent on the centre, but very much that the centre is there for them to be able to come whenever they need and however they need.
Okay. Yes, next question. In your presentation, Andy, you were explaining how the support model fits with the NHS patients care pathway. So could you explain a little bit, do patients follow a predefined program, receive recommendation, or can they also choose activities à la carte in your center?
There is a program that the busy slide that I showed you would suggest most of the program of activity, but it's very much up to the individual what they feel is relevant to them. We've developed an evidence-based program of support, but our keenness is to make sure it's bespoke to the individual. So there's nothing predefined or prescribed about coming to Maggie's. You would come and meet one of the cancer support specialists and discuss together what you felt your needs were today and tomorrow and next month. And then we would suggest different parts of the program for you to be able to consider. And then we would work with you to help you make those changes that you wish. But it's very much up to the individual and their family members to decide what they would find most beneficial.
Régine, do you have some insight to share regarding this topic as well?
No, not precisely. When the patients come in our centers, they usually stay for about 18 to 24 months, depending on the centers. And usually it's really the patient who gives us the timing when he wants to come or not. We try to give appointments every 2 weeks usually.
Okay. And how many activities in average they are participating in?
We have really two different kind of activities, individual care and then the group activities. Usually the individual care, they can make about 12 to 20 cares, depending on the center. And then they can follow as many group activities as they want.
Okay. So during the last webinar, we discussed a little bit that you observe a difference in proportion of male and female patients. So do you have specific activities dedicated to male patients? I don't know who would like to. Yeah.
In Belgium, we don't have specific activities for the men or for the women, but it's true that we have more women than men coming in our centers. One care which is really easy to give to the men, it's reflexology. It's an easy way for men to come in our centers. But it's really cultural. For the men, it's always more difficult to accept that they need help. Easier for the woman.
I think that would be the same for us, Régine. Over the years, we've seen an increase in the amount of men who are coming to our centres. But as you say, culturally, I think men feel somewhat disabled in their ability to come and look at the emotional impact of a diagnosis. When we very first opened 27 years ago, about 10 to 15% of the population who came were male. Now in the UK, 40% of the population who come to our centres are male. And we do have some specific programs for them. So some of the courses that are specific to prostate cancer are male specific, but also we run men's groups in the centres to try and give an opportunity for men to be able to come to something that is specific. But as you described, Régine, men would be able to access any element of the program. We've tried to make sure also that we have a representation of male staff, but also male volunteers in the centres to try and give that natural flavour of this being open to anybody coming to the centres. And I'm sure that's the same for you, Régine.
No, for us, it's really difficult to find male staff. Usually when we put double layers, we mostly have women coming in. And I speak for my center in Verviers, we have about 10% of men and the other rest are women, principally. So it depends also on the oncologists who centers their patients. We have more patients who have breast cancer than other cancers, for example.
Okay, and I have also a question regarding the age of the patients. So, do you have specific activities related to the age of the patients? Do you have activities for teenagers, for instance, or for children?
So I'll answer for you. Go ahead, Régine.
Yeah.
In my center, we don't have specific activities for teenager or children because we don't have children or teenager coming in. And that's it. We don't have specific activities depending on the ages.
So across Maggie's, we have a wide age range coming to the centre. So there's no lower limit and there's no upper limit in terms of who we would support. And we have some specific programs looking at children, children who have a parent or a grandparent or a sibling going through a cancer diagnosis. So we run kids' days on a weekend, and those days are to try and help the children understand where mum or dad goes for their treatment. They get a chance to see the radiotherapy machine or the chemotherapy suite, to normalize it and make sense of it. And then there's a art therapy session for the kids to be able to express some of their questions and thoughts and fears. We run teen evenings for teenagers, although that is often more complicated to establish a larger group for, but we certainly open those out, and we do family work. And then in some of the centres, we would look at specifically working with other voluntary sector organisations that support an elderly population. So working with Age UK to make sure that a very elderly population feel able to make use of the centre, both practically, but also at an emotional level. We're aware that as an organisation, our average age is about 8 to 9 years younger than the average incidence of a cancer diagnosis. So we are supporting a younger population, but our keenness is to make sure that we're still available for people in their 80s, 90s and older.
So teenagers from the family, but also teenagers affected by cancer?
That's exactly right, yeah. So teenager, it's rare that we would support children with a cancer diagnosis because they tend to be treated at specialist pediatric oncology centres who have very well-developed support facilities. But definitely teenagers with a cancer diagnosis who are often treated at adult cancer hospitals, and absolutely, as you say, teenagers who might have a family member going through a diagnosis, yeah.
Yes, one question regarding from United States. So they ask us if you know if there are similar programs in US.
Yes, so at the very start of Maggie's, it was Maggie and Laura Lee, who's our chief executive, who tried to look at what was established already, and they based Maggie's on an organization in America called the Wellness Community, which is now the Cancer Support Community. So there is the Cancer Support Community across the United States. A lot of what they offer is a virtual service, so it's an online service, but there are some built spaces. Maggie's keenness was to make sure that Maggie's as an organization had a very strong focus on the built environment. So our built spaces have a high attention to detail in terms of the outside and internal space. So they are built buildings on a hospital site adjacent to the cancer centre. I think some of the facilities in the US might be not necessarily adjacent to the hospital, but certainly purpose-built for the individuals coming for support. So the cancer support community in the United States.
Okay. Regarding yes, this is so. Next question: do you have the ability to support all patients who are coming to your centers, or do you miss resources in order to answer all their requests? So, I don't know who would like to start. Régine?
Well, in Belgium, we surely miss resources. We try to do our best. We try to welcome most patients we can, but it's really we really have a financial problem. All the care are financed through donations, through service clubs. So we have a few financing through grant application with the Belgian Foundation of Cancer, for example. But otherwise, we don't have any financing outside donations. So it's very difficult for the houses in Belgium to have enough therapists and to give enough time to the patients.
So similarly, Régine, Maggie's is we're an independent charity, so we self-fund. Each of the centres are financially responsible to maintain themselves, and that's a real pressure for us every year. But we work hard to make sure that that's the case. And our aim, exactly as Régine says, is to make sure that anybody who comes to the centre or walks through the door is supported. It may well be that on the day that you walk through, that all of my colleagues are busy, so running a group or a course or seeing somebody, but you would always be welcomed. A volunteer would always say hello. You would always be able to have a cup of tea in the space. And if nobody was able to speak to you immediately, we would take your details and phone you later in the day or phone you the next day. Our keenness is to make sure that people have access to the support that they're requesting within a 24 or 48-hour period. And once they've seen a cancer support specialist for that initial conversation and assessment of what their needs are, and then accessing the program hopefully within the next couple of days as well. But it is a real challenge, and it's a real challenge, I'm sure, similarly for Régine, the increasing volume of people diagnosed with a cancer diagnosis and the chronicity of treatment, the fact that people are having treatment much longer, it increases their need, understandably and appropriately. Our keenness is to make sure we can respond to that and flex to that, and that's partly why we want to make sure that there's a Maggie Centre at every cancer centre in the UK.
You mentioned that you have strong links with oncology centers and with oncologists. So are they participating and providing guidance in defining the activities? I don't know who would like to reply.
In most centers in Wallonia, yes. Usually we have oncologists at the board of directors. At SPACBB, for example, we have a scientific commission. Every time there is a new activity we want to propose, we check with the oncologist if they are there to it, if they are okay with it, if this activity is part of the integrative oncology. So it is very important for us to have the okay from the oncologist, and certainly to protect the patients. We don't want to do something which is too dangerous for them. So we all have support from the oncologist.
Yeah, I would absolutely agree with Régine. I think that relationship with the hospital is fundamentally important, partly because it's often the hospital the primary signposters of people to our centres. And it's also really important that the hospital trusts what we're doing. So we similarly have a professional advisory network across the UK, a senior consultant from each of the cancer centres advising the centre on new innovations or new developments and giving guidance to the organisation. It's a very important thing to work collaboratively and collegiately with other cancer professionals, whether that's in the hospital or other charities. And it's often the case that we have healthcare professionals co-facilitating some of the courses or workshops that we run within the centre. The example I described of the head and neck rehabilitation wellness clinic is facilitated by healthcare professionals who come and use our space, and then we join them to provide the psychological support as a result. So it's often a very tight, close working relationship, but in a separate building to the hospital buildings.
Yes, similar questions. Are you open to all types of activities in integrative medicine, such as acupuncture, traditional Chinese medicine, or energy-based practices? Are there some cases where there could be some contraindication?
Well, as long as it is, sorry, Andrew.
You go ahead, yeah, carry on.
As long as it is accepted by the oncologist, we do those activities. We always analyze if it's really interesting too for the people, for the patients, if it really gives them some results and if it really helps him to adhere to the medical treatment.
And at Maggie's, the vast majority of our support is psychosocial and practical support rather than direct therapeutic support in terms of a therapeutic modality. The things that we include, like stress management and Tai Chi, Qigong, are focused around that kind of relaxation response or exercise component rather than therapeutic intent, as some of Régine's approaches are. And that will continue to be the case at Maggie's, but we will very much signpost to other resources who would provide those sorts of intervention.
Some questions regarding the recruitment of the practitioners. So what criteria do you use to hire practitioners, and what kind of experience are you looking for? Régine, do you want to start? Or?
Yes, for the individual care, for example, we usually like to have people, if they have a scientific background, of course, it's always better, but they must have experiences in oncology. For example, for the massotherapist, they must have experience in oncology methods. Okay. For the social aesthetics too, we prefer to have people who have experiences with patients too.
So there are specific training programs dedicated to oncology?
Yes, in Belgium we have special training programs in schools or private formations to specialize in oncology. You have oncologists massage, and also in aesthetics, you have schools who are designated to teach social aesthetics.
And within Maggie's, the paid staff are either oncology nurses by background, oncology therapy radiographers, or sometimes oncology occupational therapists. And the psychology or psychological therapies team come from a range of backgrounds, not always from oncology, but from general psychological practice. So they're all qualified professionals who have an undergraduate degree, all with a postgraduate degree, and all with a minimum of 5 years experience in oncology care. The nurses that we employ tend to have had a minimum of 10 years experience in oncology care because of the complexity of cancer treatment and helping people to make sense of and translate. You need people who've had very good experience in cancer care. And often it's the case that they've worked in the hospital that Maggie's is based at. But trying to get the right qualifications, but also the right style of person, the person who wants to be facilitative in their support rather than treating in their intervention, and trying to get that right balance, because it's a different way of working at Maggie's than working within the NHS. I know I had to unravel myself from working in an NHS mindset to work at Maggie's different, but we're very fortunate to work with very high caliber colleagues.
Yeah, that was the next questions. So do the team and practitioners need to meet cultural or value-based criteria? What are the value promoted by the center? I guess.
Yeah, I'm sure it's the same for Régine, but definitely not that the NHS doesn't have a strong culture and value, but it can be different at Maggie's. And the focus is different because we're not giving people chemotherapy or giving them medication. Our focus is on their psychological well-being. And it's really important that there is a cultural shift for healthcare professionals to make in that focus around psychological well-being. But there is training given, and also importantly structured supervision. So a key part of every team is to make sure that we have a staff supervision session every week for an hour and a half, which again is a very different resource than within the NHS.
Well, the people working in our center must of course have a lot of empathy for the patients, and they must not only give the care, but they must also be ready to listen to the patients and to take time for the patients. And we really want to have a good team who is really close to the patients too. So that's very important.
The last question regarding impact analysis. So in your presentation, Andy, you mentioned that Maggie was focused on the importance of the environment, the bird, the skies, the trees. Has the impact of architectural beauty and nature been measured in your centers?
Yes, it has. So every part of the programme has an evaluation at the end of it, and also on an annual basis we do an audit. So the statistics I gave during my presentation are from an annual audit of over 2,000 people who've been coming to Maggie's, describing the impact of the centre on. We work closely with master's degree students and PhD students to come and work with Maggie's to look at particular themes, either the built environment, the garden space, or different parts of the programme. We don't have an active research space within Maggie's because at the moment we don't have the resource for that, but we collaborate with researchers who help us evaluate the programme. And I'm delighted to say that, as I showed within the feedback on one of my slides, people really value that support and recognise the impact of that support.
Okay, and the last one, clinical research programs are gradually being established to demonstrate the value and the impact on the patient health. Are you participating to clinical research, or are you willing to participate to clinical research in order to, you know, to show clinically the importance of your work?
Yeah, we certainly are, and we would work very collaboratively with researchers to be able to look at key parts of the programme. It's important that the centres aren't research facilities, but it is also important that often people come into the centre want to be able to give feedback on the impact of the value of the addition of psychosocial support to ensure that other people affected by cancer have that resource. So we're very open to make sure that we robustly look at what we do and why we do it to make sure it's of the highest quality.
Okay, so we are running over the time, so we still have some questions, but we'll follow up afterwards. So thank you very much, Andy and Régine. So the webinar is coming to end. So a big thanks for your participation, and we hope this session has provided you with a better understanding of the incredible contribution of your cancer support centers. And so we will see you in 3 months for the next webinars on cancer patients. So see you soon. Bye.
Thank you.
Thank you. Bye-bye.
Bye.